Hi, this is Krista Dare. I am the chair of the Sherman Oaks Neighborhood Council Public Safety Committee. And today we have two very special guests. First, we have Carolina Goodman. She's a retired educator. She's the resident of Sherman Oaks, and she's the current chair of the Committee for Criminal Justice Reform for the League of Women Voters of the Greater Los Angeles. We also have Aguierre. Her pronouns are they and she. Ale is a first-generation queer Latin community member born and raised in the Sylmar area of San Fernando Valley. Ale is formerly an early education teacher. She recently graduated from San Diego State University with a master's in women, gender, and sexuality studies with a focus on abolitionist and liberatory teaching. Ale helps organize the coalition CAT911 San Fernando Valley team. And with that, I would like to turn it over to Carolina.
So Ale and I are here to share some ideas with you and start a conversation about how calls for service can sometimes be addressed by alternatives to 911. For nonviolent emergencies, there are a number of other appropriate first responders than a police officer.
So we are from a group called CAT911-SFV, or Community Action Team 911 San Fernando Valley, which spun off from CAT911 in Los Angeles. The vision is that communities would have the resources and strong interpersonal relationships needed to respond to problems in healthy and effective ways. And some of these ways include peace building, navigating and responding to mental health crises, and building community amongst each other. So our work is based on principles of mutual respect, interrelatedness, and reciprocity. So CAT911 is working to create community and collective care throughout the San Fernando Valley. So with this, we have partnered with mutual aid groups such as Breaking Bread in Pacoima to provide food and other necessities. We've also created a survey that has gathered data amongst our community members that focuses on public safety, community investment, and alternatives to crisis responses. We're currently developing a community mural project to illustrate community safety and healing, and we are making presentations at neighborhood councils about alternatives to 911. We are also creating databases of resources and contacts for different parts of the valley and plan to make information available on a refrigerator magnet, and overall hope to share our information amongst the San Fernando Valley.
We will highlight some pilot programs around Los Angeles. We will go over how communities can work together to solve problems. We will share about programs in other parts of the country that are having positive results. You may have heard Chief Moore on multiple occasions state that the police are not equipped to handle mental health crises, homelessness, and addiction, and is asking for more resources in those areas. Chief Moore encourages us to work with each other, with government, with social services, with local businesses, and with nonprofits to solve problems.
But what about the idea to use non-LAPD personnel when it comes to calls involving the homeless or the mentally ill?
Oh, absolutely. I'm not okay with it. We've been asking for it. How do we get there? We can't get there quickly enough.
So what is it that we can do?
Mutual aid projects are a form of political participation in which people take responsibility for caring for one another and changing political conditions, not just through symbolic acts or putting pressure on their representatives in government, but by actually building new social relations that are more survivable.
So it's important to note that mutual aid is not charity. It's about a community coming together to meet the needs of its most marginalized members. We have a research page that we will share with you just a few of the mutual aid organizations in the Valley. So some of the names are San Fernando Valley Partnership, which strives to promote healthy and drug-free communities. National Alliance on Mental Illness. San Fernando Valley has a helpline that assists people and helps provide families and loved ones with mental health conditions with services, and No Home Alliances, which is an organization of residents and stakeholders in the East San Fernando Valley. They are committed to addressing local issues and improving the health of our community.
It's likely that you are already familiar with RYLAN, Ready Your L.A. neighborhood. It's meant to prepare neighbors for taking care of each other during a big disaster like an earthquake.
Actions. It all starts with you getting to know your neighbors.
Now, you might be thinking, I don't even know my neighbors. Well, by using Ready Your L.A. neighborhood, you will get to know your neighbors and you will create a disaster response plan together.
During your 90-minute meeting with your neighbors, you will determine a gathering place where you will meet after a disaster. You will discover the skills that you and your neighbors collectively possess and learn how you can help each other after a disaster. You might even find out that there's a nurse who lives right across the street. And you may also find out who might have equipment such as a ladder or crutches.
An important part of your meeting is filling out the contact list. This lists everyone, including your neighbors who may need assistance, such as those with a disability, those who are elderly, children who may be home alone, or homes with pets. If you know who lives where, then you'll know who to check on when something happens.
So before the pandemic, I took part in the Ryland program by inviting 20 of my neighbors for snacks and to show them what we could do when 911 will not be available to respond to our calls. The program is based on neighbors knowing each other. Not everyone showed up, but everyone who came later talked with neighbors who didn't attend. We made a spreadsheet of our names, emails, phone numbers, and relevant information. And we discovered that in our group, we have 2 doctors, a nurse, a retired social worker, a contractor, and a family who had a lot of camping equipment like stoves, generators, and tents. The principles are the same for supporting neighbors in need. When you know each other, you build trust. Neighborhood Watch, is another program that you may be familiar with, which relies on neighbors knowing each other. Remember, saying hello goes a really long way.
Whoever you are, I have always depended on the kindness of strangers.
There are 2 pilot programs currently operating in Los Angeles. One is called Crisis and Incident Response through Community-Led Engagement, CIRCLE. It's working currently in Venice and in Hollywood. Calls are diverted to CIRCLE to deal with unhoused individuals, to do well-being checks, calls involving loitering, indecent exposure, noise disturbances, and needle disposal. The other program is called Therapeutic Transportation Pilot out of the Los Angeles Fire Department. It operates out of station number 5 on East Temple Street 24 hours a day. It connects people with mental health services. The next station will be 59 in West Hollywood. The plan is to eventually have one in every supervisor's district. You would just dial 113. You may have heard about 988, the Suicide and Crisis Lifeline. It offers 24/7 call, text, or chat, access to trained crisis counselors who can help people experiencing suicidal, substance abuse, and or mental health crises, or any other kind of emotional distress. People can also dial 988 if they're just worried about a loved one who might need crisis support.
So in addition to the programs that Carolina mentioned that are in Los Angeles, here are some examples of the successful programs around the country. So as of right now, Oakland has 2 programs. So first is the Mental Health First program, which is a volunteer service run by health professionals and community members that operates Friday through Saturday, 8 p.m. to 8 a.m. And then Mobile Assistance Community Responders of Oakland, which is a government-funded program and works daily 7 a.m. to 11 p.m. Denver, Colorado has Support Team Assisted Response, or STAR. this is a program that has been successful that it has actually been added to the city budget program. So it is the first to be added to the program, and and this program itself has rarely needed to call the police for backup. Atlanta, Georgia has policing alternatives and diversions, or PAD, and New York City has Be Heard, or Behavioral Health Emergency Assistance Response Division.
We want to thank you for listening to us today. Here are our email addresses. If you have any questions or just want to reach out, please do. We do have a resource document that I will email to Christy, and Christy can make it available either on the newsletter or on the website. Well, remember that these are pilot programs and they're not operating all over the city yet. The 113 was the therapeutic vans, and they operate out of fire stations. Right, so they're hoping to get one in every supervisory district. So that would mean 5 therapeutic vans. The 9881 is a suicide and crisis lifeline. And that is actually a national number, but here in LA, it goes to the Didi Hirsch group, if you are familiar with Didi Hirsch. And they deal with people experiencing suicidal, substance use, and or mental health crises. The best part about that is that you can actually call that number, you can text with that number, and there's also a chat function. So it's brand new. It just rolled out a couple weeks ago, 988.
I can offer Los Angeles Tenant Union, which is an organization that's based in LA. And I feel like maybe they could be able to help with the fact that some of your unhoused neighbors haven't been able to find housing in the last 3 years. So I could share their number right now if that feels like. So it's 213-986-8266.
I have one other one that I'd like to share with you. You may already know about it. It's LA County's homeless outreach portal. And what they do is they send out homeless services outreach team to the area.
Sherman Oaks Neighborhood Council Public Safety Committee really thanks you for your time.
Thank you again for having us.
Thank you so much.